Welcome back. Good morning, Kenya continues. My name is Mike Migwe, and today we are talking about eye health. How often do you take care of your eyes? Now, the world is set to celebrate the World Sight Day tomorrow. That is the 12th of October 2023. And this year's theme centers on the eye health of people in the workplace. Hence the theme, Love Your Eyes at Work. And in studio to help me with this conversation, I'm joined by Dr. Michael Gishangi, who is the head of Ophthalmic Services Unit at the Ministry of Health, Mr. Fred Haga, who is the Director of Special Needs Education, and Mr. Samson Wawero, who is the Executive Director, Kenya Society for the Blind. Welcome, gentlemen.
Thank you.
Karibuni sana.
Thank you.
Naendelea vizuri. Now, I'd love to start off with your sentiments on generally what is World Sight Day and what is its importance in as far as eye health is concerned. Let me start with you, Bwana Gishangi.
Thank you very much, Michael.
Yes.
World Sight Day is marked annually on the second Thursday of October.
Yes.
And this year it falls on tomorrow, the 12th of October. And this is a day we talk about the priority issues in eye health, so that we are able to engage with the public, we are able to engage with the country at large and the whole world to just understand and see how important eye health is, the importance of one having good sight to enable a person to work and do most of the day-to-day activities.
Bwana Fred,
Yes.
your sentiments about World Sight Day.
Thank you, Mike, and good morning, Kenya. I really think this is a special and important day. And for me, both as a person who provides services to that population and having been there myself, a consumer of the services that are provided,
Yes.
targeting people who have visual impairment,
Yes.
it is a good time to take stock of the ground that has been covered, but also to bring out issues that will lead to the creation of awareness with regard to eye health and the consequences and what can be done.
Yes.
So it is a time when people get to know
Yes.
all that there is to be known about this. So it's a very important day, and I'm happy that in the country we observe and celebrate this day just like other countries of the world.
Good. Bwana Wawero, your sentiments on the same?
Thank you, Mike. Nice to be here.
Yes.
This is a day that we come together to raise the awareness of the burden of blindness. World Sight Day and the theme, Love Your Eyes at the Workplace, really should remind us that it's time for action and that avoidable blindness is really causing us to lose many people who lose their eyes.
Yes.
And this number is huge. It's a calamity, and we don't know about it.
Yes.
I know Dr. Rui will be talking from the statistics perspectives, which when you check, it will tell you that the people who are on the risk of going blind are 1 out of every 4 Kenyans, to give it the right context. And the problem is people are not informed of where services are, how they can access them, because preventing a disability is the best thing before it occurs. And so this day, we join the world in coordination of the International Agency for Prevention of Blindness to say what extent the burden of blindness can cost this country a productive population, because at the workplace means we need to be productive so that also our economic well-being as a nation can be taken care of. But also to emphasize is that partners in the eye health space in Kenya and the government are only able to reach a small fraction of the people who are on the risk of going blind. But the people of Kenya and all stakeholders need to know that partners are doing a lot, like the Vision Impact project that is happening in 7 counties of this republic that seeks to tackle this issue of the loss of sight in a very special way. So it is a very important time that we need to discuss and have this conversation about eye health.
Dr. Gishangi, I'd love to know your sentiments on the status of eye health in the country and the key trends related to visual impairment and blindness.
Thank you. Let me say that the burden of visual impairment or the proportion of people who are blind is quite huge, and the impact are quite heavy. Statistics say that about 4 people in 1,000 population are blind as at the moment. If you calculate that, you get to about 250,000 Kenyans who are blind. And out of that, about 80% could be treated or prevented. So what it means is that close to about 200,000 are people who are blind and do not have to be blind. Now, there are others who have visual impairment, severe visual impairment, which are another huge number, up to about 750,000, who may not be seeing very clearly. And if some interventions are provided, they would be able to see much better and engage with the world in a much more comfortable way. Now, the unfortunate bit for the moment is that still not a very large number is able to access the services. We are talking about 20% or 22% are able to access the services, even when the services are there. And there are several reasons why people are not able to access services. Sometimes there are issues from the members of the community themselves, issue with our service delivery points, distances from the community, from the villages, grassroots to where services are available, and so forth. So we are also trying to investigate and study how best to deliver services closer to the people, just like the ministry is doing, or what we are doing is engage community health promoters to improve access, awareness, and refer appropriately and in time, and so forth. Usually, as Samson has said, it's always much better to prevent. Some issues or some problems like cataract, which is the leading cause of blindness, is treatable and curable. So these are some things that we are working on. Yes, we have done quite a lot over the last 10, 15 years, but we still have to do much more. The reason why also the burden is going high is that you realize that issues of blindness or visual impairment increase with age. As the population continues to age, as you continue to have more older people, the proportion of people with blindness go high. So this is something good that our life expectancy is going high. But what it tells us to do is that we need to up the game to be able to provide the services much more efficiently and in larger quantities to ensure that even as they grow old, they grow old and are able to live a high quality of life. So that is the burden of blindness and visual impairment in Kenya.
Now, the World Sight Day this year's theme cuts across all professions. And for instance, teachers spend a lot of time doing various tasks. They spend time in class, then they are doing other things. Bwana Fred, I'd love to know what or why is it essential for teachers to prioritize their eye health in the workplace?
Mike, not just for teachers actually. I believe everybody should prioritize, but I will keep my comments in the context of teachers.
Okay, just a minute. I'll come back to you. But there's something I saw somewhere, Bwana Samson Waweru, about Vision Impact Project on the objectives and the partnership between Kenya Society for the Blind and Christian Blind Mission. Would you give an overview of that initiative?
Yes, so as I said, the burden of blindness, and as also emphasized by Dr. Gishangi here,
Yes.
is really huge. And it means partnerships are the key to ensuring that we can show the government or demonstrate maybe what direction we need to take in terms of addressing this problem. So the Vision Impact Project is a 4-year project that is generously funded by the Christian Blind Mission, which is an international non-governmental organization based in Germany that seeks to empower local partners, have the capacity to tackle blindness through screening. So the Vision Impact Project is in 7 counties, that is Bomet, Kiambu, Embu, Meru, Kajiado, Kwale, and Vihiga. And we want to encourage the population in these 7 counties to come out for screening. So screening is where they come and get checked. We have a technology called PIC, a portable eye examination kit. So the teams in these 7 counties, we are also working with lead partners who are organizations and hospitals that have been in the eye care space for a long time. And as you can see also, Christian Blind Mission is a faith-based organization. And when you see, we talk of Kiambu, you know Kikuyu Eye Hospital,
Yes.
who is the lead partner in Kiambu County. And they are the ones who are going out to the field, to all the constituencies and all the wards in the 4 years to ensure that they can screen as many people as possible. In Bomet, we are working with the Tenwek Eye Hospital. In Viga, we are working with Sabatia Eye Hospital. In Kwale, we are working with the Kwale Eye Center. In Embu, there is a Fred Olos Foundation. And in Meru, there is the AIC Health Ministries. And also in Kajiado, we have the Operation Eyesight. Kenya Society for the Blind is supporting all these 7 counties also. So that those who have found to be blind are also not left behind. There are people who have already lost sight, and they are just sitting at home, and they don't have maybe a lot they are doing, because not many people are aware that also those who go blind can be helped and supported through rehabilitation, given technological skills and rehabilitation skills, and they can also be independent again. We are also working with the Ministry of Education as Kenya Society for the Blind to, at least in these 7 counties, have a model inclusive school, so that because now we are talking of inclusive education, so that a model inclusive school can show the country how we need to move towards inclusive education, because we have been doing special schools where we just learn together as blind people in a school for the blind. And so we are moving so that we encourage both the students who have special needs to learn alongside the students who don't have any disabilities, because that's the reality of the day after school. In university, we were in class with all the other students. There is no class for the visually impaired and class for those who are sighted. Outside here at the workplace, we are all working in the same sectors. There is no jobs for the blind, there are no jobs for those who are sighted. And so inclusive education is the way to go. We are also promoting training of people we call community rehabilitation assistants, so that we can take the form of CHAS or community health volunteers. So we form a special cadre of people who can generally take care of rehabilitation needs of those who are found to be blind. So we train them on how to help those who have lost their sight get registered with National Council for Persons with Disabilities. We train them on how to teach them to use a white cane so that they can move independently by themselves, and also how they can do basic daily tasks, so that they can also found a footing in whatever jobs or whatever economic activity they want to engage in. So this, as you can see, is really an integrated, people-centered and a very comprehensive project.
Yes. Bwana Fred, before I cut you off, we were talking about why it is essential for teachers to consider and prioritize their eye health in the workplace. Please continue with your point.
Yes, thank you, Mike. Actually, eyesight is very critical to learning. About 80% of learning takes place through the eyes. And therefore, whether you are a student or a teacher, sight becomes extremely important.
Yes.
And if you're a teacher, it would really help if you are able to assess and get to know your learners to the extent that you are able to find out whether the learner is able to see and participate in your lesson. But even you as a teacher, it is critical that you really prioritize your eye health, because that is basically part of your tools of trade. You need to see your learners.
Yes.
You need to be able to write on the board.
Yes.
You need to be able to really be on top of all that is happening within that context.
Yes.
And so you'll find that it is very important. And by the way, if I may mention this, in this country, many people who have visual disabilities
Yes.
and have succeeded in completing school and going for tertiary or university training end up training as teachers. So while 80% of learning takes place through the eyes, you are also able to adapt and compensate and see what is able to be done in case as a teacher you have lost your sight, all of it or part of it.
Yes.
And I would like also to mention that that's why there is an international movement that concentrates on education for learners with visual impairment.
Yes.
And if I may say, right now there's a big conference going on. It's called the ICVI Africa Conference right here in Nairobi.
Wow.
That is specifically focusing on education of people who are visually impaired. So sight is very critical in the education space, whether you are a student, you are a teacher, or any other provider of any support service.
Yes.
Because it is critical. Thank you.
We are in a digital age, and learning has also become digital, and prolonged screen time sometimes may have effects on the eyes. I'd love to know from you, Fred, what are the preventive measures maybe that teachers and even students can undertake to prevent eye health related problems?
Yes, that is very correct, Mike. As we live in a digital age, we are exposed to certain things that might not be that good for eye health. I think the obvious answer is that we really should limit the extent of exposure to the blue light from our digital devices, or if we are to use them sparingly. But also it is important to know what kind of measures you can take so that the light and that exposure does not directly affect you.
Yes.
And I think Dr. Gishangi might be able to speak to this a little bit more, that it is really important also to be able to seek medical advice on really what somebody should do so that you are able to protect your eyes even as we go through the vagaries of the digital times, so that as a result of the technology that we have and that we use, we are not exposing ourselves unnecessarily to harmful devices.
Dr. Gichangi, in line with what Bwana Fred has said, what is the best time for anyone to go and say, I'm going for a normal eye checkup? When is it necessary? Is it when the eyes have started bringing problems, or when is it important to go for an eye checkup?
Thank you. Now, first, let me expound slightly more on what he has said about digital eye strain. While it is good that we are advancing in terms of technology, and just like I had said earlier on that our life expectancy is going high, so we get benefits that we have to work on. Now, as we have advanced with technology, digital eye strain has come because we are using computers, we are using the phones significantly more. We are exposing the eyes to much more blue light. The eyes are so to say, focusing in simple terms, significantly and for a long time.
Yes.
So we recommend that people, get some times off the computer, and look for what we call, after 20 minutes of concentration, you can look at objects which are about 20 meters away for about 20 seconds, and you do some deliberate blinking, because the idea is to let the eye also relax and also keep lubricating the eye.
Yes.
That way you maintain some healthy eye, and you may not have more and more issues, digital strain. And also we adapt the technology that we have, the computers and the phones, to do a bit of block, or anti-glare, something like that. That is how we look at the eye strain. Now, with respect to when and how to go for eye check, we recommend that once every year it would be good to have some eye check, and all as recommended by the doctor, because I may identify your problem and feel that you may need to be visiting the hospitals every 6 months or so.
Yes.
It's good, especially even for newborn children, when they are born.
Yes.
We at the hospitals do some initial assessment, and because children are very special, and if they have eye problems that are not attended to in time, we have a lot of losses,
Yes.
They are growing, and so what it means is that if the problem is not attended to, the eyes will not mature as would be expected. Now, again, as Fred Hager had said, engaging in schools, it's good to assess children when they are getting into school.
Yes.
To ensure that they are able to engage with the schooling, able to see the blackboard clearly, and that way they'll be able to perform much better, and so forth. Remember, I had also said that as you grow old, the problem of visual impairment comes in.
Yes.
So with time, you need every year, or as recommended by the doctor, to have some eye examination. When you come because there is a problem, because you can't see, or because you have some pain, or because the eyes are tearing, it means that problems have already set in, and we will be treating a problem that has already come in, and doing less of prevention. Yeah.
Now, as a doctor, you must have the tools to determine the level of a problem in the eyes. What tools do you use to determine if a person has glaucoma, what tools do you have, do you use? Yes, you can.
Okay, thank you, Michael. I had come with a few,
Yes.
which I hope you'll be able to understand.
Yes.
But basically, at different levels, we have different tools. And at primary care level, you could just have a torch that you just examine the eyes, and you are able to see that this eye is not normal.
Yes.
And that is enough information to tell you, refer this patient to an eye specialist or to an eye clinic.
Yes.
Again, this is another tool that can look into the eye and be able to get more and more information. But very, very important is this chart, which is usually found in most of the eye clinics in Kenya. It is placed at a specific distance, and it is able to say this person is not able to see as is required.
Okay.
Or this person can see. Now, when you cannot see as is required, then you are sent to a specialist who will be able to assess further why you can't see. So these are some of the trends. Again, we also have, especially as Fred Hager had talked about, teachers need to be able to read.
Yes.
And so sometimes we use charts which are graduated well for reading, saying that any person who cannot read this level has a problem with reading, and so should be assisted,
Yes. Maybe you can hold that up for the camera to.
Yes, this is called a reading chart. Is a tool that we use to assess the reading, and we know very well that after the age of 40, and especially for teachers, they would want to place the book slightly far. That's evidence that you need assistance with some spectacles like these ones, which are used for reading. And if, for example, you're not able to see the distance, then we are able to correct that one. Also, sometimes with spectacle or with what we find to be the problem.
Yes.
Yes.
That is how you
There are, of course, many others when you now go to the detailed examination of at the clinic level.
So this is the first stage?
This is the first stage at primary level. Then you go on, they send you to more advanced examinations depending on the first initial examination.
Yes.
Yes.
Now, Bwana Samson,
Yes.
I'd love to know in what way is the Vision Project contributing to the empowerment and inclusion of people with visual impairment in the Kenya Society for the Blind?
Thank you, Mike. The Vision Impact Project, as I say, is extremely comprehensive in how it supports the whole spectrum of eye care services.
Yes.
From screening to treatment to the referral pathway, and then now for those who are confirmed to be irreversibly blind,
yes,
to help them with rehabilitation.
Yes.
But just to also comment on the issue of the digital technology and the blue light, is that it's very important also to go to an ophthalmologist who will then send you to an optometrist for refraction on the right glasses that you can use when you have to access such devices for longer periods. Sometimes the thin line is that there are already those of us who think we have good sight, but we strain when it gets to the devices, and we periodically have to lean towards the screen to see clearly. So there are devices that can really assist such people to access the digital devices so that they don't even further damage their sight. On support of those who are blind, there is also another very important category called the low vision. These are people with very little sight. They are not completely blind like I am, and they may need some devices to enable them function optimally. These are like magnifiers. They are handheld magnifiers and some other advanced magnifiers that they can use. So we are also working to raise the awareness through the Vision Impact Project, and we are showcasing what low vision devices we can use in our schools, and we can also help other Kenyans who are working to use in their workplace. We have exhibitions at Panari Hotel where the International Council on Education of the Visually Impaired is happening. So that conference is very important because in the Vision Impact Project and their contribution to eye health in the 7 counties has shown that when we assist those with low vision, then they may not necessarily need to lose their eyes. But also the most important is those who have already gone blind. How can they be empowered? Most of us, or most of those who lose their sight at adulthood, end up wasting a lot of productive years before they figure out what they can do in their new found world. And this is normally the problem because you don't want to accept that you've lost your eyes just like that. It's very difficult, and it's also a very traumatizing stage of life. So we as Kenya Society for the Blind, working with the Christian Blind Mission, we've put in place various rehabilitation strategies to enable those who go blind be able to adapt as fast as they can so that they don't even lose a lot of their productive years. So we have something we call tele-rehabilitation. Over the years, it is only Kenya Society, at Kenya Society for the Blind, that has been doing advanced rehabilitation and helping professionals be able to access technology through adapted computers so that they can go back to work. We've also been meticulously training orientation and mobility, because when you've lost sight and you need to move by yourself, then things will be easier. But you see, most of the time when you're blind, you have to look for a guide.
Yes.
They have to take you everywhere. You have also to look after their expenses. So blindness comes with a burden that there is a double cost to everything. And the devices that we also use are really expensive. So telerehabilitation is seeking to bridge this gap by ensuring that we can produce video clips.
Yes.
And these video clips can be used by caregivers at homes where they have a person who has lost their eyes, so that they can see the demonstrations and help the people who have lost their eyes also access these trainings so that they can start being independent. We also send to them devices like white canes, so that when they are at home and they need these devices, we have a way we send them down to the counties and they are taken to their homes, so that they can start getting this important training. We also have done a curriculum called the Community Rehabilitation Assistance Curriculum. It has very many aspects of loss of sight. How do you tell, how do you count money, for example? How do you do your hair? How do you do your cleanliness? Not only walking, but you see, you also have to look good, you have to be well groomed, and you have to take care of yourself without saying, you know, most of the times when you walk around and let's say my collar is not looking nice, the person who I'm with will be asked, why is his collar not looking nice? But you see, at the same time, the blind person themselves can be able to tell that this is not looking nice and adjust it by themselves.
Welcome back to Good Morning Kenya, and today the conversation is centering around eye health in the workplace. And before we went on break, where Bwana Samson Waero, you were speaking on a point about the inclusion of people with visual impairment in the Kenya Society for the Blind. Can you finalize on that point?
Yeah, I was talking about how we are using technology to ensure inclusion through telerehabilitation. And also we have piloted a project in Machakos called tele-refraction. One of the biggest challenge of the eye healthcare space is that the workforce or the human resource is really limited, and mostly you have more eye health personnel concentrated in Nairobi and its environment, and when you go to the periphery, you'll find there are very few or even no eye health service provider. So what we are doing with CBM and Essilor Exotica is that we want to use technology to refract people from any rural setting. So we will train a nurse in a dispensary at Matu in Machakos on how to bring in a patient on a video, and then that video is connected to a qualified optometrist in Nairobi. The optometrist has an app that can screen this patient from Matu, and they refract them, and they can tell what glasses is good for them, and these glasses are sent to that village. So we are using the internet and technology to bring services closer to the people without them necessarily having even to come to Nairobi to get tested, and or for them to get to know what kind of glasses they may require. So these are solutions that really can help the country get services to very many people, because even uptake of eye care services, people, though they have problems, those services in the health facilities. So when we go for our outreaches, you'll find this is when they now know, oh, there is a screening for free here, let me go. Then when you check, they have lived with a problem for a long time, which can really be rectified by a very, very small interventions. So ours is to urge Kenyans that there is assistance all over the place by government, by donors, by partners, and by organizations like Kenya Society for the Blind, and also faith-based organizations. So they just need to come out, get checked, and get given the right intervention for them to be able to live more independent and impactful lives.
Bwana Fred,
Yes.
how can teachers, for instance, strike a balance between working and taking care of their eyes? Because most of the time they are in class, then they are marking exams, they are talking to students. Where does the balance lie in all this?
Okay.
Yes.
Thank you for that question. I will get back to that, but I want to start off from where Sam has left.
Yes.
The issue of inclusion, especially of those who have had issues with their sight.
Yes.
In the education sector, the ministry has what are called the Education Assessment and Resource Centers. And these are the centers where children who are suspected to be having issues like with their sight are assessed, and should it be determined that they need to be referred to doctors or eye clinics, that is done. But for those whose conditions are permanent, then the ministry also includes them in the education system.
Yes.
These children are placed in schools where they are able to be supported.
Yes.
And education is extremely critical, because with education, and I want to take this opportunity to confirm that indeed having issues with your sight does not bar you from getting a decent education. And so anybody listening should know that despite the issues you're having with your sight, you are able to get the right care and you are able to get a decent education in whatever institution you'd like to go to in this country,
yes,
as long as you can get the support.
Yes.
But coming back to your question, the balance, and I think this is a really, really important question that you're raising, because most of the time you'll find that teachers are using their eyes. And I make reference to what Dr. Gishangi had said. You could actually put your eyes at strain. You could be straining. And I think he gave some really important steps to take, like the issue of taking breaks, whether it is digital, blue light, or other things, so that you are not exerting undue strain on your eyesight.
Yes.
So as a teacher, you really need to be conscious of your eyes, just like you need to be conscious of all parts of your body. In this country, people are very concerned about their internal organs, their heart, their exercise. I would like to appeal to everybody, teachers included, that it's also important to be conscious about your eye health.
Yes.
Because there could be things that you're doing and you're inadvertently subjecting your eyes to really harmful situations.
Dr. Gichangi, talk about some of the preventive equipment. I can see you have several there. Quickly, just touch on the preventive equipment that we have.
Thank you. I'll first make a point from what Fred was talking about.
Yes.
That teachers use eyes a lot, and so all effort should be put to ensure that their health, the eye health, is maintained. And we, as the Ministry of Health, we are working with schools in the school health program to provide health, including eye health, to the students and the teachers. And so is the situation for many other workers. Now, going to what you're asking me to do, and in the context of the theme of World Sight Day this year,
please,
that love your eyes at work, it's good to protect your eyes, especially wherever you work. For example, this is protective goggles for somebody working in the laboratory where some chemicals may spill off and injure the eye. This is protective goggles from people welding, because we know heavy exposure to strong lights, dazzling light into the eye, it will cause some damages. There are many other protective measures, including in agricultural farmers and so forth, welding and grinding and welding, because flying metallic objects easily get to the eye, and that way they get injured. I would also want to say that among the commonest reasons for emergency admission into hospital for the eyes is injuries, especially by flying metallic objects or flying, stone chips for people in masonry and so forth. Yes. So we have all the reasons to protect our eyes, and you see it very well, as Fred has said. Yes. You need your eyes to work, even in the juakali industry, in the agricultural industries, in the laboratories, chemistry, and so forth. So we need to protect our eyes to ensure that we are able to work much better and also improve on other aspects of our health.
Thank you so much, gentlemen, for coming to Good Morning Kenya and sharing insights on the importance of eye health. We have been talking to Dr. Michael Gishangi, who is the head ophthalmic service unit at the Ministry of Health. We've also been talking to Mr. Fred Haga, who is the special needs education, special need director of special needs in the Ministry of Health. And Mr. Samson Waweru, the Executive Director of Kenya Society for the Blind. I have been your host, Mike Migwe. This is Good Morning Kenya. Keep it KBC. We have more lined up for you. Good morning.